The following podcast is by Dr. Shawn Weiss, President of Senior Health and Wellness Group on the Answers for Elders Radio Network. And welcome back, everyone, to the Answers for Elders podcast network with Dr. Shawn Weiss from the Senior Health and Wellness Network. Shawn, we've had an amazing hour together as we've talked about all the different situations of preparing for winter and moving into a new chapter in the world. And we've talked about a lot of external factors. We talked a lot about, physical situations and how home health can help. But, one of the things that's been going on, obviously, is with the pandemic. And I know that right now we're seeing phenomenal increases in Alzheimer's and, cognition. And we just received some updated statistics on Alzheimer's that about blew me away for the state of Washington. I don't know how it is nationwide compared to our state, but I've heard that Washington is one of the most highest populated for those affected with Alzheimer's disease, which we never understand why. It's just kind of an interesting dynamic. But anyway, tell me a little bit about how about cognition impairment. How does home health help, and what is the process involved in that?
Well, we know where we are right now is it was already a problem with cognitive impairment, but this pandemic has really threw everybody for a loop. We treat a lot of patients in assisted living facilities, for instance. So as an example, the national rate in assisted living for some type of cognitive impairment is hovering between 70 and 74%. So 70% of, so 7 out of 10 assisted living residents have some sort of diagnosed cognitive impairment. And that might be mild cognitive impairment through different stages of Alzheimer's, any different types of dementia. So if we remember that dementia is not a diagnosis, it's a group of symptoms. So somebody might have dementia, but okay, well, what type of dementia? So we may not always know that. But certainly with this pandemic, we have seen a rapid decline in people that are already having cognitive impairment, for very understandable reasons. Isolation, decreased socialization, decreased activity levels, all of those things affect their overall health and affect their cognition and their ability to do things. We're seeing more memory deficits, more behavioral issues since the pandemic started. So it's quite sad, and we're seeing a lot of issues that where we come in with home health and we are trying to get people back to being active. And this population tends to fall through the cracks. They always have, because most people are like, well, they're not going to remember you were there anyway. So why do we need to exercise? They're not going to be able to do it on their own. So why do we need to have therapy come in? And that's something that I'll get on my soapbox so much, because it's just so not true. There's tons of medical studies that show those with cognitive impairment, even in Alzheimer's stages, benefit highly from daily activity. So, there's just things that you need to be educated on, and families need to be aware of what to look for and how you can help. So the studies show everywhere that increasing activity levels with somebody with a cognitive impairment, not only does that improve their strength and their balance, even though they might not remember you were there, you are seeing improvements in appetite. You're seeing improvements in digestion. You're seeing decreased sundowners issues. You're seeing decreased behavioral issues. You are seeing improved sleep patterns. So overall health, just from being active, is critical. So we do a lot of treatment and even memory care units where we will come in. And what's great about home health is we can do baseline assessments. So we are getting a cognitive level for your loved one, which is wonderful to have, because, most of the dementias are progressive in nature. Unless they're a medication-induced cognitive issue, the dementias are going to be progressive in nature, some more rapidly than others. So we want a baseline assessment so that if we need to come back and revisit 6 months down the road, we could see what has changed and recommend the appropriate level of care for those residents. And whether, in assisted living or in your own home, you might have a loved one living with you. And you're starting to see those changes. Maybe just because of the pandemic, you're starting to see a massive decline. What
Sure.
can you do? So that's a situation where home health can come in and educate on cognition, educate on the stages, best communication strategies, how to maximize. I always had the philosophy of maximizing what they can do instead of focusing on what they
True.
can't do.
True.
So when you have that attitude of maximizing the skills that they can use on a daily basis with, occupational therapy and physical therapy, you create such a better quality of life for those residents.
Yeah.
So, I get on my soapbox about this because it's so, so, so important. And we see the wonderful benefits in our patients that we are working with. And like I said, you have to accept the need for repetition.
Yeah.
They're not going to remember to, use the call light or use their pendants. They're not going to remember to grab their walker every time they get up or use their cane every time they get up. So they're incredible risk. The fall risk is exponentially increasing in this population.
Well, and
so
also with Alzheimer's dementia, movement is huge to help with memory, to help with, get brain function. And I know a lot of the therapies is about, I've seen YouTube videos about a lady that sits there quiet until they put on, classical music or something musical. And all of a sudden you see her standing up and she's dancing and she's in the middle of the floor. So those kind of things, to make sure that she can move and she can function is huge.
Yeah, it's about, we do a lot of interviewing with the family. We want to know about their life. We want to know what they did when they were working, what types of things they love to do. They might be in a situation now where they're not very verbal and they're not getting up and moving around. So our job as nurses and therapists, whether it's PTOT or even speech therapy, have been brought in because of their nonverbal. Once you tap in to something that's familiar, that something will trigger, because their short-term memory may not be there or great, but I tell you, you tap into long-term memory and you're going to find some fascinating things that happen. It's really, really fascinating, but doing a lot of interviewing and digging in to finding those positive triggers to get the patient active and conversing and willing to participate is the thing, is just the willingness to participate. And to me as a therapist, I don't care if I go in and they have a wonderful day and then we have a great session. I'm getting them moving. They're going to benefit it whether they like it or not, whether they know it or not. You're going to benefit from the activity level.
Absolutely. Absolutely. So obviously increased activity can help in so many ways: circulation, breath, respiratory, vascular, all the different types of areas. If somebody has, let's say, a loved one that has been quarantined during the pandemic and they are not sitting up very often, they're not doing things, they may not be necessarily ready for home health yet, because what would you suggest are good first steps?
Well, we get a lot of families and loved ones who are making the complaint that they just are sitting in their chair all day, they don't get out of bed. Getting them to just come into the kitchen to eat, where you start seeing a huge decline in just participation of daily activities. So, whether or not they're able to handle, home health coming in, certainly things you can do. You want to increase supervision. If you know that they are having issues with memory, where they might leave the stove on, or they might do something that might be of danger to them. So you want to have the right amount of supervision for them. But while you're supervising, encourage them to go in and take care of their daily task. Maybe it's brushing their teeth or grooming and doing their hair in the bathroom. And you'd be surprised at things that they will tap into, but you want them to participate. That is exercise and that is activity. You maybe help them in the kitchen, maybe baking their favorite bread, do it together. You can tap into so many things if you don't allow them to give up. And a lot of times, when you have somebody who's declining in cognition,
Sure.
It's not their fault. They're going to change in personality. They're going to change in their demeanor, for instance, changes. And you need to be able to accept that. That's,
Right.
that may not be how mom ever was before, but certainly mom is there, and you need to be able to have her quality of life be the best that it can. And what
And
can you do to help?
we've seen a lot of probably more cognition impairment through the pandemic than
Mhm.
what's actually normal. So
Right. And isolation is a terrible thing for
it's a
that.
horrible
Mhm.
thing. And depression, loneliness is
Mhm.
huge. And it
Yeah,
can be such a contributing factor to that piece.
absolutely.
And how, and when you're lonely or when you're depressed, you internalize. And so the
Mhm.
internalization can cause to just cocoon in. And I think one of the things to help your loved one is to encourage them to get out, go do
Mhm.
things, like even if it's go for a drive, and let's look at
Absolutely.
fall leaves in the trees, or
Mhm.
let's go to church. I want to take you to church with me this week, or whatever that might be.
Yeah.
Find a way to celebrate life.
Yeah.
And
We encourage one
whatever.
positive thing a day. If I do one positive thing a day, that is
Yeah.
going to improve your health and your really your soul, right? Your
Mhm.
spirit. You need to be able to do those things. And you're right with the depression. On that note, if you're noticing, maybe it's yourself, but it could be mom or dad or grandma or grandpa.
Absolutely.
If you're noticing these symptoms since the pandemic, please don't hesitate to make a physician's appointment. They have great depression screening tools at the doctor's office,
They do.
to see if you maybe need medication,
Mhm.
or to see if we need blood work to see what's going on. But the
Mhm.
depression symptoms, it's exponential in terms of what has happened during the pandemic in all age groups, not just seniors, but
Right.
all age groups. So
Right. Right.
definitely a problem.
Well, we're really glad that you've been with us this hour, and certainly thrilled to get the information that you have always, Shawn.
Mhm.
And for everyone, Shawn is going to be back soon, and we're going to have a whole other area that we're going to be talking about. But in the meantime, I'm looking forward to fall. Hope all of you are staying safe. And again, be good to each other. We would like to thank you for listening to this podcast by Dr. Shawn Weiss, CEO of Senior Health and Wellness Group, focusing on wellness and prevention strategies for seniors. As a fall prevention specialist, Dr. Weiss provides family support and education to keep your loved ones safe. You can learn more by visiting her website at www.seniorhealthandwellness.org.